Hello, I'm Janice Molnar, Deputy Commissioner of the Office of Children and Family Services, Division of Child Care Services. It is my pleasure to welcome you to this training. COVID-19 is an unprecedented global health crisis like we've never seen before. It has changed every aspect of our lives, from the way we communicate and socialize to the way we work and learn. In New York, we've been in the process of reopening different businesses across the state, but that doesn't mean that we can just pick up where we left off. Whether your program remained open, you've just reopened, or you are planning to open, child care looks different. There are changes to drop-offs and pickups. People are wearing face coverings. There are daily health screenings, and schedules, rituals, and routines will have been adjusted to comply with the ways of the new normal. Children might find themselves in newly designed or rearranged spaces and surrounded by children and adults who will have parts of their faces covered. They may be coming back to you having experienced loss or other traumas. Each of us has experienced something different, and it's important to remember that so that we can continue to move forward in a safe and healthy way. And that's why we need to embrace this time with patience, kindness, and caring with children, families, co-workers, and ourselves. With all of the changes that this health emergency has brought about, children will feel a whole range of emotions that they may not be equipped to handle or appropriately express. And because of this, they may exhibit challenging behaviors that we're not expecting. We need to be ready to help them as they try to make sense of the ever-changing world that we all are now living in. At OCFS, we are your partners in addressing issues and concerns as they arise. We're doing all we can to be quick with our responses. As part of our commitment to you, we're presenting this training to provide you with information to help make these transitions smoother for you, the children in your care, and families. Thank you for the important work you do to keep New York going. Remember, together we will get through this. Stay safe, stay strong, stay New York tough.
Hello, and welcome to the New York State Office of Children and Family Services training, supporting children in childcare during the COVID-19 emergency. I'm Mark DeSico.
And I'm Casey Becker. I'll be your other host for this training. Thank you so much for joining us.
Now let's start with some housekeeping. For this training, we won't be using the chat box. To communicate with us, send us your questions and ideas to the ECETP mailbox at the address seen on your screen.
And we also wanted to point out that due to the COVID-19 public health emergency, it's been impossible for us to get into childcare programs to obtain current video footage. The footage you see throughout this training reflects best childcare practice, but may not reflect the most current guidance from the New York State Department of Health for operating childcare programs at this time. For example, adults you see in the video will not be wearing masks, but you must wear your mask at all times. COVID-19 has dramatically changed everyone's lives. From our personal lives to our professional lives, we've all had to adapt to many changes during this public health emergency. Before leaving my house, I used to make sure I had my wallet, my keys, and my phone. But now I make sure I have those things, but I also check to make sure I have my face covering and my hand sanitizer.
Children have also had to make major adjustments. They've had to shift from going to a school to remote learning at home, or from celebrating milestones with parties and gatherings to drive-by parades, and from being able to be with their child care providers to having to touch base with them via technology.
And children crave consistency, routine, and human contact. And when they lose these things, they can feel unsafe, unsecure, and out of control. And when children can adapt, adequately process, explain, or express these feelings, they may exhibit behaviors you're not used to seeing in them.
This has been a lot for all of us to process. So, whether your program has been open this whole time, serving essential workers, or you're in the beginning phases of reopening, or you find yourself debating when to reopen, we hope to provide you with ways you can support children and families during this ongoing public health emergency. Our goal is that by the end of this training, you will be able to identify signs of stress or trauma in children, implement strategies to assist children and families experiencing stress or trauma, recognize differences in program operations and how they can affect children and families, and demonstrate effective ways to communicate with and respond to children and families during this public health emergency.
So let's get started by talking a little bit about stress. Now, according to the American Psychological Association, stress is a normal reaction to everyday pressures, but can become unhealthy when it upsets your everyday functioning. There are 3 levels of stress: healthy stress, tolerable stress, and toxic stress.
So we'll start with healthy stress. And healthy stress in children is stress they can cope with. And there's tolerable stress in children, which is when they can cope with the stress because they have someone there who can support them and be there for them. Toxic stress can occur when a child experiences strong, frequent, and/or prolonged adversity, such as physical or emotional abuse, chronic neglect, caregiver substance abuse or mental illness, or exposure to burdens of family economic hardship without adequate adult support, maybe due to the adult's own stress, absence, or difficulty balancing during these times.
Let's go to this video with Dr. Nefertiti Pointer, an early childhood specialist and national trainer with the Devereaux Center for Resilient Children, for some more information on children and stress.
When children are dealing with stress, they need the adults around them to be in a good place. And when I mean in a good place, stress impacts all of us. The way stress impacts children is a little bit different because at this time, there might be feelings of fear. There might be feelings of confusion. There might be feelings of being overwhelmed. And when their bodies are so small, they don't really know how to handle that. When we're thinking about signs to look for of stress in children, one of the things that I think we all want to remember is that children, especially our youngest children, they don't have the vocabulary yet to say, I'm anxious, or I'm nervous, or I'm confused. It is our responsibility to start to give them that language, but when they're young, they can't always articulate themselves that way. So some of the things that they will say, my belly hurts, I can't sleep, I don't want to eat. Some of those indicators may say to you, okay, I need to pay closer attention. I was a classroom teacher before I became a mom and before I became a trainer. And one of the things I used to say to my children is sometimes you get a boo-boo that I can see. I can see that you hurt your knee, or I can see that you hurt your arm, and I can put a Band-Aid on it. But sometimes you have a boo-boo that's on your heart. And I can't always see what's in your heart, but I can see your tears, I can see your frown, and when I see those things, it makes me think sometimes you need a Band-Aid for your heart. So what I say to my 5-year-old, when I maybe don't see a physical hurt, I will ask her, do you need a Band-Aid for your heart? And usually one of the ways that we heal a heart that is hurting, we hug it. We hug it. And then from the safety of that hug, we can talk about the feelings in a way that makes sense to her. We write things down, we draw pictures, and I think an environment where all of those practices are being carried out is one of the best things we can do for children right now.
Thank you to Dr. Pointer for those great tips. I especially love the language she used to explain the inside hurts. What a great way to help young children begin to put language to their feelings.
And remember, if you're having concerns about the children in care during the day, find time to talk to them. Maybe ask them about their experiences or ask them questions about how they're feeling during daily health checks, meals, or outdoor play. Now let's shift from stress to trauma. According to the National Child Traumatic Stress Network, trauma is defined as a frightening, dangerous, or violent event that poses a threat to a child's life or bodily integrity, which is the importance of self-ownership of people over their own bodies.
Now, I recently had the opportunity to sit down with Barbara Kaiser, the co-author of Challenging Behavior in Young Children. She's been working in the field with children in childcare for many, many years as a director, speaker, and trainer. And we spent quite a bit of time discussing what this new normal might look like in childcare programs and what effects this pandemic might have on children. We'll be seeing many moments from that interview throughout this training. One of the things we talked about was how COVID-19 is a collective trauma. So let's go to this first clip to learn more about Barbara and what the term collective trauma means.
I am an expert on behavior, and because children's behavior has become such an intrinsic part of everything that we're all dealing with, I have suddenly been asked to become an expert on COVID-19 and trauma, and I've done a lot of research and work, and because it's called novel coronavirus is because it's new, and we're all struggling to figure it out.
So as I've attended a couple of the trainings that you've done, I've heard you talk about COVID-19 as being a collective trauma. So I was hoping we could talk a little bit about what you mean by that and why that is so important for us to really recognize.
Yeah, the term collective trauma has been used a lot to describe the impact of this worldwide crisis, and it's having an effect on millions of people. And the term trauma typically refers to the impact that a traumatic incident has or incidents have on an individual or a few people. But collective trauma refers to the impact that a traumatic experience, which affects and involves entire groups of people, communities, or societies. And really, if we take a minute to look at what's happening, I think it fulfills that requirement. Collective trauma is also very extraordinary in that it's not only bringing distress and negative consequences to individuals, but it actually changes the entire fabric of a community. In fact, it can impact relationships, and as we've seen, it alters policies and governmental processes. It can alter the way society functions and even change its social norms. Basically, with a collective trauma, reality is turned upside down for a large number of people. And I think if you stop and look at the changes that we've all had to make between social distancing, wearing masks, sheltering in place, what's happening with children in school, going hybrid, going virtual, it has really had that impact.
Now, Mark, I recently saw something on social media that said this year's school supply list would include all the regular supplies, but should also include patience, kindness, and gratitude. And in addition, Barbara also mentioned the need to recognize the bravery of everyone as we all have coped with the changes and new learning we've all had to do.
Yeah, Casey, these are really powerful statements for things we all need to remember as we go back to school in whatever way, shape, or form we're doing that this year.
Absolutely. Now, there are specific things that happen in our brains when we are experiencing stress or trauma. So let's go back to our conversation with Barbara for more information.
When a person is feeling toxic stress or undergoing or living through a trauma, what happens to their brains is that it produces an abundance of cortisol. And as a result, cortisol is a hormone, and our brain starts swimming in it, and it disrupts the part of our brain called the prefrontal cortex, which is the area of our brain that helps us to think. It's the thinking part of our brain. It's responsible for our attention span, our decision making, our problem solving, and our emotional regulation, which is key. So whether school is open or they're learning virtually, children are finding themselves in a constant state of elevated arousal and are living day to day in what is called a fight, flight, or freeze mode. Because when our cortisol raises to that level, the part of our brain that takes over is our amygdala. And the only thing that an amygdala can do is fight, flight, or freeze. It's the oldest part of our brain, and it was very useful a long time ago. It's not that useful anymore. So as a result, children with this abnormal cortisol pattern are that's induced by toxic stress are at a very high risk for aggressive and challenging behavior. They're going to have trouble sitting still, paying attention, concentrating, following rules and directions. They'll probably find it very hard to recognize and control their impulses, emotions, and behavior, communicate their needs appropriately, understand other feelings, or form satisfying relationships. And many adults are going to feel that way too, because we're all going through this together. And in addition, what happens is with this high level of cortisol, it can create a state of hypervigilance. And as a result, children might lash out for what they perceive as a threat. And you might not even recognize that perception, and therefore not understand why are they behaving this way. But hypervigilance is also a symptom of our cortisol levels being extraordinarily high. In most situations, when we experience a trauma or toxic stress, our cortisol levels go up, but then they go down as we start to adjust. But because this trauma has been for 6 months now, our cortisol levels are all very high. It's going to take time for us to really readjust and reduce that level of cortisol.
Earlier, Dr. Pointer gave us some insight into how children might show you they're experiencing stress. During my discussion with Barbara, we walked through what we might see in children of different ages who are experiencing trauma. We started this discussion talking about infants.
But the research has shown that infants actually can have an enormous ability to sense others' anxiety. And because we hold infants very close to us when we do, and apparently when we as adults are stressed, we exude a different scent. And infants can smell that. And as they smell it, they too begin to become very anxious. They inherit our anxiety. And as a result, often they may fail to thrive, they may become difficult to soothe, they can resist contact, and they don't really respond to human stimulation in the way they would under other circumstances.
So what about our toddler friends?
Well, toddlers may end up experiencing language delays if they were sort of developing their language and all of a sudden their language just isn't coming along the way it was before. Resort to aggressive behavior to express their feelings of uncertainty. Often they'll engage in a lot of temper tantrums, but some other kids may become withdrawn and resist efforts to interact with others who are trying to comfort them. And separation is going to be very hard for toddlers. They're at that age where it's not easy anyway, but because they are fearful and maybe worried that that person won't return, there is a great deal more separation anxiety than there would be under normal circumstances, though I don't really know how to define normal anymore, but previous to COVID-19.
Yeah. So what about our preschoolers?
Well, when they have been exposed to trauma, may be very hypervigilant because they don't have a good sense of social relationships. And they may become, which I thought was very interesting when I was researching this, attached indiscriminately, even to acquaintances and total strangers, because they're looking to make the contact and they're really kind of lost with all the social cues and what is really expected of them and what people are really feeling. I think there's a lot of confusion for them right now. And often what will happen is they will misinterpret facial expressions and body language in a negative way, even though you might not mean it. And because these guys generally are in what's called an egocentric state, some of them may blame themselves for the stress around them and see things through a sense of shame and worthlessness. And they'll struggle with strong emotions and often express their frustration because they become much more easily frustrated through their bodies becoming provoked to unprovoked aggression, particularly in moments of emotional closeness where you might think you're holding them and everything seems fine, and all of a sudden they'll push you away with the parent. Well, I'm really kind of talking with families. They must have experienced that, especially during sheltering in place. And a lot of times, even though they had good play skills prior to all of this, they may suddenly regress. And especially if play involves symbols and language, such as dramatic play. But dramatic play becomes very important for them because this is where they basically look and experience what's happening in the adult world and put it into their own perspective so they can deal with it. But the other thing that happens is I think not only have we all felt that we have lost total control of what we can and can't do, I think young children have also feel that they've lost control. So they might try to control everyone and everything in their environment in order to help them feel safe. Both toddlers and preschoolers, probably some of them, not all of them. And you have to remember, some of them are going to walk into the child care center as though nothing had happened almost. They'll be so happy to see their friends. But others may suddenly engage in regressive behavior such as thumb sucking, whining, even having difficulty with toilet training issues. So kids who maybe were out of diapers might go back into diapers.
I agree. So then, that brings us, we've talked about our infants, our toddlers, and preschoolers, and that brings us to our school agers. I have a school ager at home myself, so I'm very interested to hear what you have to say about the things to look out for with our school agers.
Well, one of the important things is, as they get older, there might have been kids who've already experienced trauma prior to COVID-19. And these kids are going to be much more easily triggered or set off and have a harder time struggling with self-regulation and lacking impulse control or the ability to think through the consequences before acting. But they are all probably going to become, and I'm sure you noticed this with your own child, very easily overwhelmed. Give up on even small tasks that present a challenge. Where they might have been more persistent before, they somehow don't have that self-control to stick with it. They may behave in ways that appear unpredictable, oppositional, volatile, and extreme, and often react defensively when normally they wouldn't have. They might just become very defensive and feel attacked because they are perceiving things through a very different lens. And others may at times be very over-controlled so that they're, not doing any of these things, very rigid and unusually compliant. And some might even appear spacey and detached and out of touch with reality. Because everyone responds so differently, it's something that, to be aware of. The chances are, if there are any changes in older children's behavior, even younger children's behavior, that it is a consequence of what they're experiencing. And so to help them learn how to deal with it and focus on building their resilience. Because childhood trauma puts children of any age at a greater risk for developing social processing impairments that will later affect their social perception and their ability to interact with their peers and others. So we have to remember that children who've experienced trauma, especially, and some of these older children, and I think teachers need to be aware of this, they're going to have short-term memory issues, which will make it difficult for them to remember what's asked of them. So when teachers give directions, do it one at a time. And the neuropsychological research suggests that children who've experienced neglect or physical abuse prior to this, and maybe even during COVID-19 while sheltering in place, can have problems in attention, adapting behavior to suit it to different situations. So transitioning from task to task or class to class or activity to activity can be very, very hard for them. So regardless of the children's ages, we need to help make those transitions smooth and reduce the frequency as much as possible.
If you remember earlier, we talked, Casey, about toxic stress. And toxic stress in children occurs when the adult in their life is not there for them because the adult is dealing with his or her own stress.
Mark, Barbara, and I spent some time taking a deeper dive into some specific situations that might be causing children and families toxic stress in these times, such as loss, domestic violence, lack of resources, and disasters. Let's take a look.
Well, I think loss is probably the most universal stress-making concern of them all that's related to COVID-19. because it's not just loss of a loved one, it's loss of the life that you used to have. It's loss of your routine and way of life. And from one day to the next, childcare centers and schools were shut. And nobody had warning. And so everyone was sheltering in place. They couldn't see their family members or friends for weeks. And many families lost their source of income, and children whose parents worked from home, because who was used to taking care of their children while working from home, especially if their children were in childcare at school. So it became very stressful for them as well. And I think a lot of us were all trying to figure out, how do I deal with this loss? Because suddenly my life is not the life that I had yesterday, which is a huge loss. So we have to be very careful of that. It's not just losing a loved one, it's losing a lifestyle, losing all of the things that we thought we understood and were dealing with, and suddenly are no longer valid.
So we were just going to start talking about situations maybe where domestic violence is happening during COVID-19.
Yeah. And actually, domestic violence is the most commonly experienced source of trauma and toxic stress in children's lives, and it affects them in a myriad of ways. The Centers for Disease Control and Prevention have reported that in homes where violence between partners occurs, there's actually a 45 to 60% chance of co-occurring child abuse. And as a result of COVID-19 and sheltering in place, and now many children no longer have the contact with the safety net they had before. Their teachers, who would see them every day and who might be and probably were the first people to notice signs of abuse or that something was off prior to COVID-19, and maybe were the only adults that these children felt would keep them safe. So it was a very important piece of children who are experiencing domestic violence. It was a very important piece of their life. And the psychological aftermath of exposure to domestic violence can include fear of harm or abandonment, excessive worry or sadness, guilt, an inability to experience empathy, habitual lying, low frustration and tolerance, emotional distancing, poor judgment, fear about the future. And now, with the issues related to COVID-19, such as job loss and financial stress in families, fear of becoming sick, exposed racial inequities, they all exacerbate the occurrence of domestic violence. It has gone up in these recent 6 months. And because a lot of the symptoms or a lot of the ways that children express what has been happening to them are very similar to trauma and COVID-19, it's hard sometimes to distinguish which children might need more support because of this. But it can be very, very serious without this safety net. It's very hard.
Absolutely. You talked a little bit about lack of resources, but how else is that affecting us?
When you look at childhood adverse childhood experiences, when you look at the work that's been done with that, a lot of times poverty is considered one of them. However, I think it's really important to recognize that poverty doesn't guarantee trauma. But children living in poverty are at a much greater risk if there is no adult present to support and provide a sense of safety and security in a home that's dealing with constant stress, facing food shortages, housing or health issues. And what we also need to remember is that some children who are living with undocumented families can be very afraid to seek the medical care they need, in addition to not having the financial resources that they need as well, or just fear of being evicted. There is a causal link between poverty and domestic violence. So poverty plays a big sort of role in the undercurrent of what children were going through prior to COVID-19, and COVID-19 has just made it much harder for them. And we need to really think about, once again, how can we support them? In some cases, children living in poverty, the only real meal they got was at school or at childcare.
And what about disasters?
It's extremely important to recognize that the impact of experiencing a disaster and the behavior changes that might occur or how hard it might have been for the child might not appear immediately. So look for changes in behavior even months, sometimes even years after a disaster. And what you can do when children have experienced disasters and they're coming back, talk about the positive things, what people have done to support one another. But we really do need to remember, and I'm sure all of you who are working with children know whether or not that child has experienced forest fires, storms, or any other natural disasters to further make their experience with COVID-19 difficult and impact the family's ability to be there for their child, which is key, because when families are going through disasters, it's very hard for them to remember that they need to focus on their children's needs, and their child is going through it too. Because one of the things that mitigates a trauma and the experience that children are having going through something like COVID-19 is a caring, supportive adult. So if the families are having a hard time, and if you as teachers are having a hard time because you're going through all of this too, it's very, very important to remember to focus on that, because that's what will help children get through it, is that supportive, caring person.
It's important to remember that we've all had different experiences throughout this pandemic. Some families have continued to go to work to their place of work, others have worked from home, and others, unfortunately, have lost their jobs. Some children have continued to go to childcare, while others have been at home. And children have been quarantined in all different types of environments.
Casey, you and Barbara talked about this for a while, didn't you?
We did. We talked about how this pandemic has been different for everyone, and that it's so important to remember that when working with children and families. Let's watch.
And I think we all need to remember that each child is going to ask us or respond to it in a very different way. So we really need to know the families, we need to know the children, we need to build our relationships with them even more than we had to before. And every child that you will be teaching, educators will be teaching, is coming to you with their own story. Children living in urban versus rural settings, for example, will have had a very different experience. If you're in a small apartment with no terrace or no way to go outside, sheltering in place, especially if there were 4 children, 2 adults, and not enough room, will have been a very, very difficult event. Whereas if you're in a rural setting, on a farm, or even in the suburbs with a backyard, sheltering in place was very, very different. The level of parental stress before and during COVID-19 was very, very different as well. So some parents dealt with it and families dealt with it in less stressful ways than others. So that had a big impact. Children of essential workers who were really going to work, and children were in childcare at that time, or maybe they still didn't go to childcare because the other parent could stay at home, they went through a lot of stress because essential workers were dealing with so much. And then what about the children who have no siblings? The singletons. They didn't have anybody to play with. So they were now living in an adult world until things started to open up and they could return to playgrounds and see other children. And that was very hard. And then there are the kids who lost someone during the pandemic. Maybe their grandma died. That's also a whole different experience. So each one of them is coming with a story and a life experience, and it's all very different. And the more you understand and know about every child's experience, the easier it would be for you to meet their needs when they return, or what your expectations should realistically be if you are teaching them virtually or in person. It's very important. The more contact you can have, this is really where family engagement is so important, especially since they have now just spent the last 6 months with their children. And find out what are their supports, what are their concerns, and how can you adjust your program to meet their needs. I can't stress that enough.
Throughout this experience, we have all had to spend some time sheltering in place. Sheltering in place means getting inside and staying put inside a building for safety, rather than evacuating. Barbara gave us some information about the effects that this sheltering in place has had on all of us during this health emergency. Let's take a look.
Sheltering in place, how do I get groceries, how do I live my life? It was an incredibly difficult, strange experience that we all had to go through, and we need to recognize that none of us really knew how to do it well. So it's not as though, as adults, those of you who are parents of your own children, it's not that you failed them or failed yourself. We were all trying to do the best we could, and so were our kids. I mean, it took a while to adjust, and then once we'd adjusted, I think we suddenly realized, wow, this is an opportunity for me to really do things I couldn't do before, or build work, spend more time playing with my kids and doing all kinds of things that suddenly we weren't being pulled in all different directions. So it wasn't totally negative for all of us, but for some people it was really, really hard. And recovering from something like this can take a while because it does have that impact. And I'm not sure, even when things opened up, how safe we felt, how self-regulated we were, how able we were to relate to our peers. All of a sudden, the world opens again, just as quickly almost as it shut from one day to the next. And how do we deal with that? Are we safe going out there? I'm not sure if it was you, Casey, who said this, but somebody once said to me that their daughter went outside for the first time and asked if it was safe to touch the grass. So what is that about? How can they focus on all of this? How can they've never been through it before, neither have we, and how can we regulate ourselves, feel safe, and deal with this and sort of surpass the experience of sheltering in place? But it might take a long time.
This has been an extremely emotional time for many adults and many children. There are lots of unknowns, and it seems like information just keeps changing. All of us are dealing with fears, anger, confusion, and uncertainty. Sometimes several different emotions hit us all at once, and it just feels difficult to process all of it.
So it's important to take the time to focus on everyone's social emotional state. Check in with one another. See how people are feeling. See if they need help or someone to talk to. Offer help when you can. And let everyone know that feeling these emotions is normal and that you don't need to face things on your own. Now, Barbara and I talked about social emotional learning and children, so let's watch. How specifically might these experiences of trauma affect a child's social emotional abilities?
I think one of the things that's so important for everybody, the adults involved and the children, is self-regulation. And we can't practice self-regulation until we feel calm. So trying to find ways to develop social emotional learning with masks and social distancing kind of presents a whole new problem that many of us have never had to deal with before. So try and get them to express their feelings. What are you feeling? Talk to them on their level. Ask them questions about what they're feeling. Share with them what you're feeling.
Yeah, sometimes it's hard to separate, to figure out what's going on here, and then seeing how it's affecting everyone else, and really taking that step back and reflecting and taking the time to say, I have to center myself, or I'm no good to anyone else.
Yeah, and I think a lot of times we end up blaming the children or blaming the families or blaming COVID-19 instead of sort of taking a deep breath and saying, it's up to me. Chaim Gnot once said that he almost sees it as though he's the weatherman. And if he's in a good mood and he's ready to teach and he's ready to do what he needs to do, it's going to be a good class. Everyone's going to enjoy it. But if he's not coping well with his own situation, no one is going to have a good time.
Yeah.
So I thought that was a a good thought.
That's a very good thought. And that kind of leads me through this next question. You know, we're all working through these transitions and these changes. And I've heard you talk about a need for a paradigm shift. So this kind of leads us right into that. Maybe you could help us understand what a paradigm shift means and how we really can try to do that. Because it's not easy.
Yeah. No. I think, like I said, it's very hard for teachers to look beyond a child's behavior and respond right now to a child who's behaving aggressively or inappropriately or just tantruming for what you perceive as no reason at all, with empathy and flexibility, and to encourage the child to identify and tap into their own feelings. And what we need to do is we need to, instead of asking ourselves, the adults, what's wrong with this child? We need to start asking ourselves, what happened to this child? What have they been dealing with? What have they been through? And we need to find ways, and teachers need to find ways to respond to the child's inappropriate behavior that show that they care and support the child through these hard times. Because, as I mentioned, it is all about the importance of a caring adult to mitigate what the children are feeling and the after effects or the impact of this trauma as we're still going through it. So we really need to be able to do that. And so instead of seeing a disobedient, defiant, angry child who needs to be disciplined, we need to see a scared, anxious child who needs respect, kindness, and compassion. We're hearing a lot about trauma-informed practice. And I think what we really need to recognize is that trauma-informed practice is best practice. It's really not something we haven't done before. It's using a whole child approach, promoting a sense of belonging and supporting children who are struggling. So as much as we have to control how we're feeling, we have to take that deep breath, we have to look at what's underneath that behavior and help the child to feel safe, rather than to discipline them or get angry or expect them to do something differently.
Yeah. That can be really hard to do, though, if a child, say, is out of control. Because I know with this, it's scary, it's uncertain, and the little ones may not be able to express themselves with language, and all they have is behavior and feelings. And as this bottles up, and these feelings are there and they don't know what to do, they can all of a sudden seem out of control.
Yeah, when kids lose control, when kids are really out of control, when they're tantruming, when they're throwing things around, it can be very scary for everybody. It's probably pretty scary for the child who's engaging in that behavior, and it's pretty scary for the kids who are observing it, and it's very scary for the teachers because they have to keep themselves safe, the children safe, and that child safe. It's hard to know exactly what they're feeling. Chances are they are very anxious and they're really worrying about, am I safe here? I don't want to be here. Nobody understands me. They don't feel connected to their environment. There are lots and lots of reasons that come behind that behavior. Every child has a different kind of response, or like I mentioned before, their own past, their own story that they're bringing with them. Often what is behind this is a complete sense of I have no control over anything anymore. And like you mentioned, everything is so different and I don't like it. They feel completely disempowered and they just feel they maybe can't do things as well as their peers. If it's an activity and everyone is cutting or painting and they suddenly start to feel like I can't do this the same way. Or maybe it's somebody's facial expression or a loud noise or something you didn't even hear or recognize, but that child felt or perceived it as a threat. So it's very hard to know. And sometimes it doesn't really matter when they are totally out of control at that point, what is behind the behavior, because that's not the time to talk to them. That's the time to let them kind of get through it physically. So if they're tantruming, let it go through. And what you need to do is you need, first of all, to keep the other children safe. But what you do when they're tantruming, when they're throwing things around, you need to be present so they know you're there because they don't feel safe. But eye contact can become a very useful tool if it is culturally acceptable. So that what you do is You are physically present, you are very aware of what they're doing, but you're not making any eye contact with them as they are out of control in that behavior, whether it's tantruming, throwing things, whatever it might be. And when they take a breath, because every child needs to take a breath, we all need to breathe, that's not really changing the behavior, but it's what can be called a close approximation. That's what you want them to do, to take a breath, to start breathing, to change the behavior. That's when you make eye contact. And that eye contact, you now need to be very self-regulated, not take this behavior personally, but recognize your job is there to help that child calm down. That's the goal right now. And if your eye contact says, even if it's just 2 seconds, I'm here with you, we're going to be okay. His breath is over, he starts throwing things around, but that eye contact comforted him in some way. So chances are he's going to take another breath and look at you, and you're going to give him that eye contact again and say, I'm here for you. It's okay. And this is sort of a give and take thing that can take up to 15 minutes, or it can happen in 5. It depends on how out of control the child was or what's really happening inside. It's not always the same at all. And once the child has calmed down, that's when you can, if he's thrown everything around the room, okay, let's pick things up and put them back. And then how are you feeling, and talk about those feelings. But it's very important to get that child to calm down, because anything you say to that child is just like adding fuel to the fire. It's just going to escalate the behavior. So it's a very different kind of approach, but it makes a difference, and it allows the child to gain self-control and feel good about themselves at the end, because that's very, very important. And it's not punitive. So you've actually built a stronger relationship with that child, and that child knows they can trust you through no matter what.
During that part of our discussion, Barbara mentioned trauma-informed practice, and you can find more information about trauma-informed practice and other helpful resources in the resources handout on the My Activities page of your ECETP account. We all know that returning to childcare isn't going to be like a regular transition back to the childcare program, like, say, after a vacation. Things are going to look, sound, and feel very different.
Casey, childcare programs have had to make adjustments to accommodate for new school-age children being at the program all day, assisting with virtual or hybrid models of schooling, and what that means in terms of changing group dynamics. For more information on remote learning's impact on your childcare program, please refer to the Dear Provider letter that was issued on September 2nd, 2020.
As children return to their childcare programs, or maybe have to be cared for at a new childcare program, they're being asked to learn new skills and rules around how they play with and interact with their friends because of physical distancing guidelines. They're dealing with changes in drop-off and pickup times and schedules, participating in daily screenings and temperature checks, adjusting to new routines, and acclimating to their trusted adults wearing face coverings at all times.
Casey, all of this change can be tremendously scary for our little ones who can't really fully understand everything that is happening and why all these changes are necessary for everyone's safety.
So let's go back to our conversation with Barbara to learn more about how this isn't a regular transition back to childcare.
I think we have to keep in mind that no program is going to look the same as it did prior to COVID-19. And each state, maybe even each district, is going to have different procedures in place. But regardless of what they are, these new regulations are going to impact educators as well as children. None of this is going to be easy for kids to understand. And most of the suggested changes are going to compromise their social emotional learning. There's no question about it. I think that the hardest thing for children and their families will be drop off, but I think it will be very hard because the interim guidelines for childcare programs in New York State state that childcare providers should consider, when feasible, having a staff receive the child from the parent or guardian at the beginning of the day, and bring the child out to the parent at the end of the day so that parents and guardians don't have to enter the facility or program area. It also states that parents and guardians are not permitted to spend an excessive amount of time at the child care facility. So this will be especially hard if they had rituals and routines that they can no longer do. They are already feeling a certain level of separation anxiety, and there's attachment, stronger attachment to their families. So what we need to do is we really need to figure out ways that families can arrange new rituals to say goodbye to their children. Singing a song, giving them a photograph. I initially had suggested that they could give them a kiss on the palm of their hand to hold while they're in childcare. And then I realized if we did that, the children would probably never wash their hands. So that would cause a problem rather than be helpful. But I think we need to come up with some rituals and help families, once again, speak to them before the center opens. Give them suggestions of how they can make that separation first thing in the morning and then rejoining without having had any contact with them in their room, seeing what they're doing. Sometimes the end of the day and going home can be just as hard for some kids as the beginning of the day was. One of the things that teachers are very concerned about is, how do I hold or care for a child who's been hurt or who is emotionally upset and needs my connection, my physical connection, when we're told we have to maintain a reasonable distance between ourselves and the children. And one of the things the CDC talked about is if everyone brings with them as many large button-down shirts with long sleeves that they have and leave them at work, so that you put one on, and then when there's a child who really needs to be held, a child that just needs you to give them some physical reassurance, you can do so. And we all know what happens if a child is crying, but because you can take the shirt off, you're not actually going to be bringing germs or issues to other children. So after you've engaged with that child in that meaningful way with some physical reassurance, take off the shirt and put on another one. And then you'll be ready to engage with another child. So we need to really find ways.
It's really important to remember that the impact of trauma is not something that appears immediately, and that recovering from trauma is a long process.
It's also important to always try to understand what the child is feeling underneath his or her behavior. And we call this the why behind the behavior. Children just don't display behaviors for no reason. They're trying to get a need met by using the tools they have available to them. Barbara and I spent some time talking about the importance of this, so let's take a look. I was hoping we could have a little bit of a conversation about how important it is, our response to children during times of stress and trauma, and not even just our response to the children, but to our coworkers and to families and to, parents, how important that conversation is.
Yeah, it's very important. And I'm sure a lot of us are all feeling sort of jumpy, easily irritated. We're not at our best right now, as much as we try to, and our cortisol level is not where it needs to be. So it's very hard for us to respond in a way that really does support our own children or others or other people's children. But we need, first of all, to listen. We need to help children share with us, hopefully, what they're feeling. It's tempted to quickly reassure a child and say, it's okay, you're going to be fine, you're going to be safe. Look, I'm here, everything's fine. But that's not really helping them feel safe and supported. When you listen, when you acknowledge their feelings and concerns, like, I'm really nervous, are you nervous? Or are you scared? I get scared sometimes too. Those things really, really help a child feel it's okay to feel this way. And now I can stop and think through how I'm feeling and how I can deal with it. Also try really hard to build on their strengths and helping them to recognize what they're good at, because that will really support their resilience. So think about that growth and how you can identify that growth, that post-traumatic growth. And children who've experienced trauma, you need to remember, are often especially young children, but even your coworkers and other older children and other adults are often more sensitive to your nonverbal communication than anything you say. So the first thing that you need to think about is your body language and your facial expression. And they have to match what you're saying. So if you, especially kids who've been traumatized, who will misread your facial expression, even with a mask, it's really important to think about it. Be open and relaxed. Keep that comfortable distance. Don't get too close because that can be threatening. And if you are too far, you don't seem involved. If it's appropriate and it's safe, get down to their level. Speak slowly and calmly. And always connect with the child. Use their name. Joey, I think you might be feeling a little uncertain about if you can do this. You know, can I help you? So the quality of your voice should match the child's voice, tone, cadence, speed, and volume. So if the child is talking really, really loudly, a lot of times we think that we should talk very quietly to encourage them to do so. But they see that as a direct kind of confrontation. But if you start loudly and then you lower your voice, suddenly you'll discover they're going to start to lower theirs as well. And ask them open-ended questions like, are you okay? What would you like to do? What would you like me to do? And validate their feelings. Help them to problem solve once it's been identified. What can we do about it? And how can we make that be better? And also be very careful about the words that you do choose. Try and avoid the words, but. I know you're upset, but. They're always waiting. Use and. I know you're upset, and I can understand. So try and avoid but. But has a kind of hidden meaning that when children have been experiencing things that they lack control of, can really trigger. And also try and use we as opposed to you, because that implies your support rather than you are making it all up to them to make this happen, to change their behavior and anything else you want them to do. But you want to really be sure they know that you are there, you are going to support them, you care about them, and it's okay.
What advice do you have for us on responding to children's questions, how to give them what they need, but not overwhelm them?
Yeah, they're going to have a lot of questions, and it's perfectly understandable because they don't really understand the new normal any more than we do. But if you're lucky, they'll ask questions. Sometimes they won't even ask questions. See them asking questions as something as though they're trying to deal with it. It's a big step to ask questions. And then you need to answer them in very age-appropriate terms. But before you answer them, you need to find out, what do they know before? What knowledge do they already have? Because you don't want to give them more knowledge than they need to have. That's only just going to confuse them. And match their level of understanding rather than try, and this is not a sort of time where you're trying to increase it. You just want to match it. You want to really reassure them without providing complex information that's going to add to their confusion. And when you respond in reassuring ways, children are going to internalize those positive cues and work on trying to normalize things, showing children that, for example, if they ask about the mask, when you put on the mask, you're still there underneath, and play games with it. Just try and really understand that those questions are very real to children that don't understand the world around them today. And if you can just put yourself in their place as to what it would look like if you were 4 or 12, what would you want to know? And what would you want to hear? It's very important because if we answer their questions in a way in which we make it more difficult for them to understand, it will just increase their fear and their cortisol level and their behavior. Yeah. But there's not one way to answer a question. Just be very aware of how significant it is that they're asking one, which is excellent, and that your response will make a big difference if you match their level of understanding and what they already know.
This is an unknown situation that is constantly changing, so it's completely normal that we'll all be experiencing some level of fear at times. I asked Barbara for some advice on how we can handle our own fears as well as help the children and families in our care with theirs. Let's watch. What advice do you have for us as adults experiencing these fears and how we can cope with them or manage them?
Yeah, I mean, I really do believe that fear is actually a normal and adaptive response that we feel when faced with something threatening, which I think we can all agree COVID-19 at this point still is. And we're all facing these fears right now as there seems to be no end to the pandemic or the political unrest in the US and the rest of the world. So, what we need to do is look for things in our life that you can control, such as wearing a mask, limiting contact, keeping a physical distance from others. If you can limit your exposure to the news and the events that upset you, those are also things you can control, as well as finding ways to build your resilience. And I know I often say to people, stop watching the news, especially if you have young children around. Don't watch the news right now in front of your children.
I know for me personally, one thing that helps me get over my fears is knowing that people are there for me and that there are measures in place to keep me safe. And there are people that I can turn to that I can trust. What are some specific things we can do for the children that we're working with and caring for to help them feel safe, to let them know that you are safe?
Well, once again, I think what you have said about building that relationship, letting them know that you're there to support them, understanding their feelings and listening to them. You need to avoid surprises. At this time in the classroom and even at home, you need to create a caring community, and it needs to be predictable, consistent. You need to have routines and rituals. And routines are very important because they help create a sense of normalcy and safety, which I think is something children really, really need. And in childcare and at school, those routines are extremely important. You need to also provide a lot of opportunities for child-directed free play when children are in childcare, especially dramatic play, which is how children make sense of the world and how they express and regulate their thoughts and feelings and understand themselves as well as others. And they learn how to solve problems and overcome challenges through this role playing. I'm sure if you set up a medical facility in your what we often call the housekeeping corner or the psychodramatic play area, you will be surprised as what the children will do and how the children will talk about it. They know a lot. They know a lot more than they understand. So this is an opportunity for them to kind of pretend and get through it and understand what is COVID-19, how is it making me feel, support one another, and make sure that the environment, the classroom, even your home, is not overstimulating. Research has actually shown that color, lighting, sound, noise, even temperature in a room, and physical space, believe it or not, both vertical and horizontal, can increase the cortisol levels over time if it's not appropriate and affect children's stress levels. So watch the noise level. Try and keep the noise level down. If you don't have to use fluorescent lighting, don't. Think about the temperature. It should be comfortable, not too warm, not too cold. And then look at what's on the walls, what's on the floor. What are the children looking at? How confusing is it? It should be calming. There should be things around them everywhere that help them to calm themselves down. And it's also extremely important to offer kids choices, because one of the things I've talked about is this sense of having no control over the world around them right now. We need to increase their sense of control and mastery. So give them choices whenever you can so that they can feel that they are in control, at least of part of their day, of something that they can do. And also have a quiet space in your room, in your classroom, if in childcare, so that when they need some space to just get away from other people, they can. And then mindfulness exercises can be really helpful for children to just be in the present. to calm down, to think about nothing but their bodies, nothing but what's happening, inside, as opposed to worrying about everything outside. There are several mindfulness exercises available on the internet that you can download for free and then use them in the classroom. And once again, focus on your self-regulation and the children's self-regulation and those social skills. Teach them proactively, right away. That's the first thing kids need to have, is you need to focus on those social skills before you worry about anything else.
Now, Mark, we know parents are going to have questions and concerns as well. Talk to them about what's the best way to get information to them. Now, this could be via email, phone calls, texts, daily journals, or even newsletters.
Or maybe you're meeting virtually or you're filming videos. Whatever way you do it, be sure to check in with them often to get them updates, connect them with resources, or just to check in and see how they're doing.
And as we've been saying, all children and families are unique. They come from different places, and they've had different experiences and have different needs. What works for one child or family may not work for another. That's why it's important to have a variety of strategies to turn to. Barbara and I talked about this. Let's watch.
So everyone's going to have a different toolbox, but what we have to recognize is that what works for some kids might not work for other kids. So what some families have been through isn't what every family has been through, and that we're all encountering a new transition, another huge transition. And your most valuable asset is your ability to stay calm and to manage your internal emotional state. So at the same time you remain emotionally available to the children, it's inevitable that you're going to have moments of anxiety and frustration in the coming days and weeks. We do not need to shelter the children from our true feelings, but we do need to take charge of ourselves. So one of the things you can do when working with the kids is to build those strong connections. Teach and model healthy coping mechanisms so that they can move through adversity and become more resilient. So let them know how you're feeling and how you're dealing with your feelings. And they're going to learn that, because the biggest job that educators have is that of a role model. And parents as well. They are always watching us and how we're reacting to things. So if we can demonstrate that we can react to something in a positive way, and that we can be resilient, and that we can role model strength and dealing with adversity, they're learning an enormous amount without us saying anything. Yeah. Focus on creating a sense of safety for all the kids. Be flexible. It's very important to be flexible, because what one child needs isn't necessarily what another child needs. So you have to really listen and enable yourself to respond to each individual child in a way that each individual child needs you. Let them tell you what they need. Hopefully, like with asking questions, hopefully if you have this relationship, if they feel safe with you, if they trust you, they will let you know what they need. It might not be verbally. It might be through their own physicality. So you need to know every child well enough so that you can see what they need and then provide it for them. And allow them time to talk about their experiences. Even if, they're not asking a question, but they just want to share with you what they were doing. Maybe what they did while they were sheltering in place, or who they missed, or just whatever it might be. But make sure you have spent that time with each child. And you can't do this necessarily in a group, because not every child wants to share those feelings with others. They might feel that they only really want to talk about it with you. Mm-hmm. So maybe you might need to connect with them in the classroom if you can, but maybe you might have to Zoom with them when you're not wearing a mask, or FaceTime with them so they can see you and you can see them, and then talk to the families. Families are key here. Mm-hmm. I can't tell you how important. I can't repeat it enough. And then talk about the positive outcomes and what they've learned. Wow, you really learned how to bake, and you learned how to measure all kinds of ingredients, because I think a lot of families were baking. Talk about those kinds of things so they can see how, yeah, I am really good at that. We need to empower and acknowledge the incredible strengths of our kids, and even the kids who've experienced this through the lens of a trauma. It's very, very important.
It almost feels cliche to say, but these are really difficult times. All of us feel like we've been on an emotional roller coaster from day to day, and even sometimes throughout the day. We can find ourselves shifting from one emotion to another quite rapidly. Sometimes it feels like without warning. For me personally, I know I've turned to exercise and yoga, and I've increased time with my family, my wife and my daughter during this time, and that's really helped me to cope with my own stress.
And Mark, I've turned to gardening, but I know with the weather changing that I need to focus my attention on something new. So I asked Barbara for some tips on other things we can do to help us get through this. Let's watch.
So I've had days where I know I've been really cranky and I can't seem to get out of it. But what we really need to do is we need to think about how important self-regulation is and how it enables us to respond to our children and children's behavior in general in a supportive manner. And it is one of the main reasons we all need to build our resilience. And research shows, and you mentioned this, that relationships help us get through adversity faster. So to build your resilience, which will help you build your self-regulation, find someone you can talk to who's not going to judge you, but will listen. Try to get into a rhythm. Stick to a routine for yourself. Predictability can act as an emotional pillar to lean on and help you find a sense of stability during the daily grind. Go for a walk. Maintain social contact, limit social media, as I said, and TV around COVID-19, and try and counterbalance the heavy information with hopeful information, which is hard right now, I have to say. I struggle with that a lot. Carve out time for solitude. We all need some time to be alone. We all need that me time. We need to maybe set boundaries sometimes and let others around us know, I need 10 minutes. This is my me time. Think outside yourself, turning your attention sometimes to emotionally or physically supporting other people. Sometimes can actually short circuit our worries about ourselves and our own uncertainty and offer us also another layer of connection that will help us stave off those feelings that we might have of loneliness or anxiety. And take time to think about who you are. Look at your strengths. You did not know some of those strengths you actually had. As I mentioned again with post-traumatic growth, all of a sudden you realize, hey, wow, I am a stronger person than I thought I could be. Try and develop a positive view of yourself and have confidence in your abilities, as well as your ability to make realistic plans and take steps to carry them out. Because once you fulfill a task, we all feel so much better. So sometimes just figure out, what are those steps? How can I make that happen? And knowing that you're in control of your actions makes such a difference. And finally, just look for ways to find meaning in adversity. And think about, as I think you mentioned as well, Casey, all the lessons that you've learned. We've been through a lot. It has been over 6 months. We've learned a lot, but we sometimes forget what we've learned and just think about how hard things are and how frightened we are and how uncertain we are. So think about how you've changed, what you've learned, and how you can apply all of this to help yourself feel better, to build that resilience, and in essence, your self-regulation, which is so important.
We've faced a lot of hardships during all of this. I've heard many people say that this time has given them the opportunity to learn a new skill or catch up on things they've been meaning to get to. For me, I've been able to renovate parts of my house I forgot about. I've focused on my overall health, physically and emotionally. I want to keep the focus on areas where I have control in a time that has felt largely out of my control. And I may have caught up on my Netflix queue with my wife at night after our 8-year-old goes to bed. Casey, you and Barbara spent some time talking about this, so let's watch.
So I was hoping we could talk a little bit about, some of the things that we've learned or that we've gained from this experience.
Oh, absolutely. And as I was thinking about this question and doing some research, I found out, we've all heard the term post-traumatic stress. But there's also a term called post-traumatic growth, which is PTG. And post-traumatic growth is when people who've experienced a trauma develop new understandings of themselves, like you said, new skills. They develop new understandings about the world they live in. They develop new understandings about how to relate to other people and the kind of future they might have. And they start to really think about what the kind of life do they really want to live. It's sometimes considered synonymous with resilience, but it really isn't the same thing, because resilience is the personal attribute or ability to bounce back, whereas post-traumatic growth, on the other hand, refers to when someone has experienced a trauma and ultimately finds a sense of personal growth, which is what you were helping your daughter to do, and what is really important not only for us to help others to do, but for us to help ourselves to do. It takes time and energy and personal strength in order to be able to recognize that you are now stronger from the experience, you've improved your coping mechanisms, and you've developed closer relationships with your family, with your children. You've also got stronger social ties and a real sense of belonging. It often means that you have a greater appreciation for your life and what you have. And I think those of us that are privileged enough to say that, because there are some people, when I say that, that really don't have that opportunity because they don't have a lot right now and they have even less than they did before. But we can start to see new possibilities. And as a result, we become able to reevaluate our priorities and how we're going to allocate our time. And hopefully, when this crisis is over and we return to what will inevitably be a new normal, we need to remember that whether we end up building stronger partnerships with families as teachers, if we use Zoom, or remember to phone a child who might have been sick for multiple days, or just take nothing for granted anymore, what we are learning during this pandemic will help us better serve kids, our family, other people's kids, and ourselves throughout the rest of our careers and our lifetime, I'm hoping.
Barbara and I talked about so many things during our time together, and as we were wrapping up, I asked her if there was anything else she would like to share. Here's what she had to say.
But I think we need to give ourselves grace. We need to allow ourselves to make mistakes, to do things maybe not as well as we thought we could, to sometimes not be patient, to sometimes be cranky. And we need to be able to think about how to set realistic goals and take care of ourselves, because we can't take care of others until we can take care of ourselves.
We sure have covered a lot of important and valuable material during our time together. We want you to know that your questions are important to us. So if we were unable to answer your question live today, someone will follow up with you.
Now, Mark, one question we get a lot is about training certificates. And we can tell you that certificates will be processed at the end of the live training and available on your My Activities page on your ECETP account in up to 7 to 10 business days. Please note, no training certificates will be issued for watching the recorded version of this training. And if you participate in Aspire, your certificate will not automatically upload to their system. You are responsible for submitting it to them.
Casey, another question we get asked a lot is, how can I get copies of the videos? This training and other informative videos will be available to view again in the coming days on the ECETP YouTube channel. So you go to YouTube and you search ECETP and hit that subscribe button on the channel and share it with your friends. We'd like to thank Dr. Nefertiti Pointer and Barbara Kaiser for their time and all of the important and amazing information they shared with us during this training. Most importantly, we want to thank you for your participation.
Although we are all living through this global health crisis together, everyone's experience is going to be different, and everyone is going to react to the ups and the downs in their own unique way. We hope this training has provided you with some insight into how to help support children in your care during these uncertain times.
During this training, you have been emailed a link to the Participant Reaction Questionnaire, or PRQ.
Now, filling this out gives us valuable information about this training and lets us know what other topics you're interested in. Your feedback is greatly appreciated as it helps us shape future training opportunities. So please do go to your mailbox and access the link and complete that PRQ.
I'd like to thank you all again for attending this training, and most importantly, please stay safe.